Hello and welcome to Portal to Health, using the patient portal to support chronic conditions microlearning series, brought to you by the California Telehealth Resource Center. This kicks off session 1, Foundations. Next slide, please. So before we begin, we want to note that this session is purely for informational purposes. CTRC has no relevant financial interest or arrangement with any organizations related to commercial products or services that are discussed during this webinar series.
The California Telehealth Resource Center, or CTRC, was established in 2006 to share unbiased, no-cost digital health resources and consultative support services with providers and patients located across all 58 California counties and beyond. As part of the collaboration with 12 regional and 2 national telehealth resource centers, CTRC is committed to implementing digital health programs for rural and underserved communities. CTRC became part of OCHIN in 2017, and together these organizations reflect 25 years of experience-based solutions expertise. And OCHIN, where Lulu and I hail from, supports safety net health organizations and serves over 6 million patients in 49 states. And the Ocean Health Center Controlled Network, or HCCN, is the largest HCCN in the nation. Health Center Controlled Networks are collaborative groups that provide no-cost on-demand resources and training to participating health centers to address operational and clinical challenges related to health information technology, very much akin to CTRC and other telehealth resource networks. Ocean HCCN supports over 100 participating health centers using a variety of electronic health records and serving over 4 million patients. And it's funded by HRSA. And we welcome you to check out the Ocean HCCN webpage to learn a little bit more.
And just a little bit about us. I am joined by my wonderful colleague, Anjali Brown, who is a learning content designer here at the California Telehealth Resource Center. And I'm Lulu Gonzalez. I'm also a learning content designer. Thank you for having us. But before we jump in, here's a list of all of the microlearnings in this series. Each session is designed to deliver quick learnings on a specific focus that can be applied to your patient portal and disease management strategies. These sessions can be viewed in order for a comprehensive overview or as needed for targeted learning. So with that, let's go to session 1, Foundations.
Okay, so we're going to start by looking at chronic disease and disease management. Millions of Americans are impacted by chronic conditions such as hypertension, diabetes, arthritis, and depression. Estimates say that 6 in 10 people in the US have one chronic condition and 4 in 10 have 2 or more. That is a pretty staggering number, especially since chronic conditions contribute to higher risk for other more serious conditions and more expensive care. Primary care teams, alongside a network of specialists and community partners, have a large role to play in helping patients manage these conditions. This can include care planning and care coordination, physical activity recommendations, nutrition counseling, smoking cessation services, medication management, remote patient monitoring, and patient education and self-management support. When patients have 2 or more chronic conditions, they are often eligible for care management services through programs like Medicare and others. These services provide more comprehensive support and coordination of services, often including requisites for care teams, such as 24/7 access to the care team for urgent conditions, medication management, remote patient monitoring, personalized comprehensive care planning, dedicated care coordination within and between health settings, and then more patient education and self-management support, in addition to regulatory and reporting requirements for program participation.
So where does the patient portal fit in? A few years ago, Ocean conducted a survey of 96 participating health centers in the HCCN network, which looked at patient portal adoption. And at that time, patient portal enrollment was less than 15%. That means that for every 10 patients walking through the door, many managing diabetes, hypertension, or COPD, only 1 or 2 access the very tool designed to help them manage their care between visits. But research has shown It's shown us that patients who use the portal are more likely to follow medical advice, refill prescriptions on time, and stay connected to their care team. So the question isn't whether patient portals work. The question is, how do we make them work for everyone, especially those who need them the most? In fact, for some patients, the patient portal can allow your health center to meet them where they are, fostering whole patient care with greater efficiency. The portal accomplishes this through versatility, multilingual translation, and access. In this way, the patient portal can enhance the patient experience and give your patients added flexibility and convenience with features such as appointment scheduling, provider communication, test result access, bill payment, records management, and so much more. Studies find that patient portal adoption is generally correlated to increased patient engagement, improved patient retention, higher rates of up-to-date preventative care, and better health outcomes. A Pew Research study finds that low-income patient populations are more inclined than affluent populations to use smartphones to access a patient portal and manage their health care. And as mentioned, other studies similarly find improved adherence with medical advice and medication instructions among patients who use the patient portal, particularly for chronic conditions such as asthma, congestive heart failure, and type 2 diabetes.
So let's connect the dots between what patient portals can do and what patients with chronic conditions actually need. Chronic care management is all about consistency, coordination, and communication. And that's exactly where the patient portal shines. So, for example, let's take medication adherence. Through the portal, patients can request refills, get reminders, and even review their medication list, all without picking up the phone. Or consider care coordination. Instead of waiting for a callback, patients can securely message their care teams, view shared care plans, and stay in the loop between visits. And then remote monitoring is another game changer. Patients with diabetes or hypertension can upload their vitals directly from home, giving providers real-time insights without needing an in-person visit. And then let's not forget patient education. The portal becomes a hub for after-visit summaries, care instructions, and health literacy tools, empowering patients to take charge of their care. And then finally, appointment scheduling, a simple but powerful feature. When patients can book or reschedule online, it reduces no-shows and keeps care on track. So when we talk about optimizing the portal, we're not just talking about nifty tech. We are talking about transforming how we deliver care for people who need it most. By integrating these features, portals can extend care beyond the clinic walls and make chronic condition management more proactive, personalized, and accessible. And this is especially true for underserved populations. So that wraps up our Microlearning 1 foundations, and we just want to make sure there's a couple key takeaways for you. So chronic conditions impact millions of patients across the country. Effectively managing care for those with chronic conditions takes coordination, communication, and consistency. The patient portal is a valuable tool to augment chronic disease management services and support patient self-management. And let's not let this opportunity go to waste.
Yes. And so what's next? Microlearning 2 is policy development. So patient portal policy can really structure your efforts and provide meaningful improvements for staff and patients alike. So let's explore policy strategies with us in Microlearning 2. We'll see you there.